Short men have the penile frenulum cut. Have you ever wondered short men have the penile frenulum cut? Some people say yes, some people say no. So who is right? The truth is there is no single answer for every man. It depends on your body. It depends on your symptoms. And it depends on whether the frenulum is causing real problems. First, what is the penile frenulum? It is a small band of tissue on the underside of the penis. It connects the foreskin to the head of the penis. For most men, it works normally. It helps the foreskin move naturally. It does not need any treatment. But for some men, the frenulum is too short. Doctors call this frenulum breve. When this happens, pulling the foreskin back may feel tight. Some men feel pain during sexual activity. Others notice small tears of bleeding after intercourse. Some even avoid intimacy because they are afraid it will hurt. If this sounds familiar, it is worth talking to a qualified doctor. Here is an example. A man has pain every time he has sex. He thinks it is normal. He ignores it for years. Eventually, the frenulum tears again and again. The pain continues. His confidence becomes lower in this situation. Ignoring the problem is usually not the best choice. A medical examination can help identify the real cause. Here is another example. A man has no pain, no tearing, no bleeding. Everything works normally. Should he cut the frenulum? In most cases, there is no medical reason to do so. A healthy body does not need unnecessary surgery. My opinion, I believe medical decisions should be based on health, not on internet trends, not on fear, and not because someone else says it is better. Every man's body is different. What helps one man may not help another. My practical solution: if you are unsure, start with these simple steps. First, pay attention to your symptoms. Do you have pain? Do you have bleeding? Does the frenulum tear repeatedly? Does the penis bend downward because the frenulum feels too tight? If the answer is yes, do not guess. Get examined by a qualified urologist. Second, do not try to cut it yourself. Never use scissors. Never use blades. Never follow unsafe online device. Never follow unsafe online advice. Cutting the frenulum without proper medical care can cause bleeding, infection, and permanent injury. Third, ask questions during your appointment as whether your condition could improve without surgery. Ask about stretching exercises if they are appropriate. Ask about recovery time. Ask about the benefits and the risks. A good doctor should explain all of your options before recommending surgery. What you can apply today: do a simple self-check. If you have no pain, no tearing, and no problems with normal daily life, you probably do not need to worry. But if pain keeps coming back, make an appointment with a healthcare professional instead of waiting. Benefits you will receive by making decisions based on medical evidence. You avoid unnecessary procedures. You reduce the risk of complications. You protect your long-term health. And if treatment is truly needed, you receive the right treatment at the right time. My advice: do not feel embarrassed to ask for help. Doctors see these problems every day. There is nothing shameful about protecting your health. The earlier a real problem is diagnosed, the easier it is to treat. My final thought: not every man needs to have his penile frenulum cut, but no man should ignore persistent pain, repeated tearing, or bleeding. Listen to your body. Get accurate medical advice. Choose treatment only when there is a clear medical reason. Your goal should never be to copy someone else. Your goal should be to keep your body healthy, comfortable, and functioning well for the long term. Thank you very much.